I wanted to ask you, Dr. Kaplan, you are the lead author on a poster that was presented recently at ACTRIMS in West Palm on it's a prospective observational study of the repository corticotropin injection for MS relapses. Can you kind of go into that study a little bit and tell us more about that?
Yeah, absolutely. So basically, this is a real-world multi-center trial in which ACTAR, which I described previously, is used to treat relapses. And it was shown that there was clinical improvement in both patient-reported outcomes and EDSS measurements. I mean, the primary endpoints was change from baseline in the MS impact scale, the physical subcortical scale, and then also EDSS and the global impression of improvement. So basically, there's about 125 patients, a little bit older than the average population because the mean age was about 47 years of age. 88% were female, 84% were Caucasian, and the average time that they had diagnosis of MS was about 10.2 years. 58.4% of patients had experienced a relapse within the last two years, and 60% of these patients had an insufficient treatment relapse, or they developed intolerance, or they had intolerance, or limited intravenous access associated with high-dose corticosteroids. So after treatment with ACTAR, they noticed in the MSIS 29, which is a MS patient-reported outcomes scale, that there was a significant decrease from baseline by 8 points at 2 months and by 9.64 points at 6 months, which was both statistically significant to very statistically significant, the best way of putting that. And their mean EDSS scores decreased from baseline by 0.37 at 2 months and by 0.45 at 6 months, both of which were statistically significant to a p-value of 0.0001. The global clinical impression scores indicated improvement in 63.4% of the patients at 2 months and 61.4% of the patients at 6 months. And the results from this prospective observational study of ACTAR in patients with treatment-refractory MS show clinical improvement in this MISS 2021-9 version 1 subscale scores, as well as significant improvements in the clinician-rated scores, EDSS and the CGI-1. And what this did is basically we had patient-reported outcomes. We had the patients examining the patients and going through the CGI with them. And what this did is it just supported the efficacy and the tolerability of ACTAR as a treatment for multiple sclerosis relapses.
Yeah, I thought that was a fascinating poster, and what kind of jumped out at me was we were part of this trial too. Is that you made the decision in a real-world setting to treat a typical MS patient who was experiencing a relapse, and they were enrolled in the trial, and you were looking at patient-reported outcomes, which I think is the most meaningful endpoint in the real-world setting. And my practice is I get 5 days of IV Solu-Medrol, and so we just have this 5 days stuck in our head, 3 to 5 days. And so my typical ACTAR or ACTH repository protocol is 5 days also. And when you look at the data from this, when you went back and looked at those patients who had more than 5 doses, that was fascinating. Can you highlight that a little bit?
Well, basically, the FDA approval for ACTAR is actually 2 to 3 weeks of the 80 unit therapy, and so I normally use 10 days and sometimes even more, and I have found that to be more successful than 5 days. And in this study, what we found was that there was a trend. There was a trend to where there was clearly improved clinical outcome when we gave greater than 5 days of treatment. But it was, I will, just to make sure that I'm being completely honest here, it was a small sample size.